Welcome to the University of Pécs Medical School. My name is Anusha and I'm a final year medical student. Today in this video we're going to talk about the general medicine program, which has 4 module system. So we have basic module, preclinical, clinical and the rotational module. All of the module system is designed to take the students from the theory to the real patient care.
The training of the general medicine starts with the basic module, which is 2 years long, divided into 4 semesters. In this basic module, we are learning the basic sciences of how the human body works. We learn subjects like anatomy, physiology, biochemistry, immunology, and as far as public health. The essence of it all is to enable us to understand how the normal human body functions before being introduced to cases that involve diseases. We are offered different types of classes, lectures, practices, and seminars. All these enable us to prepare for different types of exams in different subjects. Some subjects need you to do oral exams, some subjects need you to do written exams. At the end of the basic module training, we end with the white coat ceremony, which ushers us into the preclinical module of our training.
After the basic module, we have the preclinical module, which lasts 1 whole school year, the 5th and 6th semester. In the preclinical module, you'll have classes like pathology, pathophysiology, microbiology, internal medicine propaedetics, and surgery propaedetics. What you'll be learning is the causes, the pathogens, the mechanisms of different diseases. You'll be meeting patients for the first time, learning how to take a patient history. And finally, you'll be learning the basic theoretical and practical parts of surgery, like suturing and knot tying. The preclinical module is important because it prepares you how to think like a clinician and how to see and diagnose diseases and eventually treat them.
The kind of subjects you would have in this clinical module, like the name suggests, are clinical subjects that you can specialize into after your graduation. First, we start with recapping the basics, things we've already covered in the preclinical module. Then we address the most common clinical situations where we are put into the role of a doctor treating that particular condition. So here we focus on the medical amnesis, the differential diagnosis, the imaging techniques, and the treatment options. This is the stage where you start to feel like it was all worth it, as you see all the hours done studying proving crucial and effective in the clinic and the hospital.
The rotational year at the University of Pécs Medical School is the final 6th year of general medicine program. Students can complete their clinical rotations in various courses, which includes pediatrics, internal medicine, obstetrics and gynecology, surgery, traumatology, family medicine, and emergency medicine. It's obligatory for us to do the exams, which can be done either at the end of every rotation or it can be done after you're done with all the rotations. So it's basically the students who plan their rotations and their exams. Practices can be done either at the university clinics or it can be done in any of the hospitals in Hungary, or you can also do it abroad, which is approved by the list at the university's website. Once all of these exams are done, there's a mandatory state exam which consists of 2 parts. So there is a written part which is done towards the end of May, and there is a practical part that is done at the hospital somewhere in the beginning of June. After all of these exams and everything, we finish off with a graduation, which is usually held towards the end of June. Over the course of 6 years, our students develop a deep academic foundation and the clinical skills that are required for the medical profession. At the University of Pécs Medical School, we are proud to support the future doctors in every step of the way. Thank you for joining us, and we look forward to seeing you in Pécs.